Man, I want to start by thanking you first because I've said this before. I think I've told you this too. I don't think if it were for you and Tom, and I think many people across the world can say this at this point, I would have ever found the no virus terrain based position. And it came at a time in my life when I had my own direct experience with moving out of a toxic environment, moving my family out of a toxic environment in which my wife's so-called autoimmune symptoms had just returned. And upon moving, they all went away. So that was at the very beginning of 2020. I had fallen for the idea that, COVID was made in the lab. And I was actually telling a lot of my family members in January and February, you need to go get masks and stuff. I knew what it was for. I knew it was going to be for mandatory vaccines and things like this, but I believe they had successfully created a bioweapon in the lab. And then came across a video from Tom talking about following dolphins off the coast of Florida or something like this. I'm sure you remember the video I'm talking about very early on. And then also your interview on, I think it was initially David Icke's platform, but I don't think he interviewed you. I think he just showed a clip of you maybe. But then your interview, I think on London Real, or maybe it was David Icke on London Real. I don't remember exactly what it was, but it was April of 2020 that I came across you, and it just made so much sense. So then I went down the never-ending rabbit hole, and here I am. And I'm so stoked to be having this conversation with you, man.
Well, Alec, I couldn't be happier that you joined the bandwagon because, you've been kind of a force of nature, really, with your enthusiasm, your youthful curiosity, and then, I watched you master the material, right, and sort of really make a transformation in terms of your understanding of science, logic, philosophy, and I'm glad that you are an advocate for the truth.
Thanks, man. It means a lot. Thank you. Let's start with your background. And I want to start with framing this conversation towards more exploration into psychotropic medications at first, because I know you have a background as a psychiatrist. So let's start there first.
Yeah, well, I used to be a psychiatrist. That's true. And I specialized in forensic psychiatry, which means that I did a lot of work inside of like correctional facilities or working with juvenile delinquents. But also I did expert witness work and taught things about the law and was involved in research. But I think the forensic aspect actually really helped me out because it's where you're asked a difficult question to give an opinion on it, right? And the opinion is supposed to be based as much as possible on science, logic, and facts. And you generally have a mountain of data to look through. Like, for example, in some cases where, let's say, I might evaluate someone accused of a crime for the insanity defense, I'd be handed usually a couple of boxes of records. I mean, it would go back to, their school records, all kinds of like statements from family members and contacts, all of their health and psychiatric records and, correctional records, criminal history, everything you can imagine. And then in addition to that, spend up to 7 or 8 hours interviewing the person. And you develop some skills in distilling down the facts. A lot of the information you have to go through is irrelevant or misleading, and so you have to sift through that, prioritize it, use skills like discernment. And whatever your opinion is, you have to defend it in a courtroom, which is very difficult. Lawyers are extremely challenging. They can be very tricky. So you can't just willy-nilly speak your mind or have an agenda. You really have to, unless you want to be embarrassed or not successful, you have to be extremely rigorous, and you get more efficient in recognizing patterns and, distilling out what is real and what's not. So that's kind of a little bit about the background that led me, into this realm. But I, of course, applied it to my psychiatric practice itself. And I had a number of key moments, along the path to realize that psychiatric medicines are, not a good thing. In fact, they're quite harmful. And I've seen lots of evidence of that harm, both in my personal experience and in the medical literature.
Did it start with personal experience first?
I think in part because it was very early in my residency training when I first specialized in psychiatry that I got exposed to this from the point of view of, the established medical system. There was a black box warning that was issued by the FDA on SSRI antidepressants. And that happened early on in my residency training when I didn't even have that much experience prescribing or observing people taking these medications yet. But this black box warning stated that in children and adolescents, that these drugs can increase suicidal behaviors, which was kind of a strange term because it being fairly vague. But one could look in the research literature and see that suicide behaviors are actually highly correlated with completed suicide. So this was definitely a serious warning. And these warnings don't even come up by the FDA unless, they're basically saying only use this drug in a life-threatening emergency, really. And I don't think you can antidepressants necessarily fit that bill. I mean, you can have a suicidal emergency with people who are severely depressed. That happens commonly, but there's no evidence that these drugs decrease the suicide risk. So with now new information that they could increase the suicide risk, and there was a very telling reaction by the faculty at the residency because they, gave us this special announcement, and then they told us, basically, we all know that really it's depression that causes people to have suicidal behaviors, not the drugs. But what we're going to do is we're going to have a policy that anytime you start a new patient on one of these drugs, you're going to call them in a few days to check up on them.
Wow.
And that was basically part of the training that I would call, and was commonly called CYA, cover your ass.
And that was a perfect example of begging the question there too. Yeah.
Of course.
Yeah.
Of course.
Yeah. So how did it evolve from there, from you understanding the harms of specifically SSRIs to also understanding the harms of benzos? And I know that you, correct me if I'm wrong on this, weren't necessarily prescribing these in any case throughout your psychiatric practice because you were a forensic psychiatrist.
Well, let me correct you, because during my 4-year residency of doing general psychiatry, I was required to prescribe these medications. And
let me stop you there. Required. What do you mean by required? Because that's interesting.
Well, I mean, my job was to take care of patients, and the way they taught us to take care of patients was to prescribe medicines. And if I didn't, I had to justify it to a supervisor.
Wow. Okay, that's really interesting to hear. So, kind of gives you a window into how much medical doctors do have the ability to deviate from what is the common dogma, essentially.
Right. Well, but, don't forget, this is in a supervised training setting. There's basically an apprenticeship type model in medicine. It's institutionalized, so it's not an individual, apprentice and mentor relationship. There's a group of mentors.
Unique to residency to some degree then.
Yeah, each residency has their own, faculty that supervise, and, you have to have your records and your plan approved. And co-signed often. So you have to do what's expected. But even, there's other constraints. Like, for example, a patient comes to you, they're already prescribed these medicines, and you can't just willy-nilly stop them because that can be dangerous. And so you're forced to continue prescribing them. Or in the correctional setting, which is part of forensic psychiatry, then the same standards apply, although they prefer certain types of drugs because some of these drugs actually have like a black market value that people use them to get high.
Like very similar to street drugs in some ways.
Well, no, they are street drugs. I mean, like, that you can get prescription opioids as street drugs, right? So it's the same thing with many psychiatric drugs.
Right.
And there might even be some drugs that wouldn't necessarily have a street value on the streets, but in the correctional setting, where it's hard to get things, right? So like some of the older antidepressants that are very strongly antihistamine, type of drugs, they can be very sedating.
Mhm.
So they may not be desirable on the street where you have access to anything, but in a correctional setting, they can have value. Even, like I'm talking about tricyclic antidepressants, for example.
Mhm. Do you think that there's any value in benzos or SSRIs?
Well, SSRIs, I would say no, and I can go into a lot more about why that is, and it's mostly because of the harm and the lack of any demonstrated benefit.
Mhm.
With benzodiazepines, there are a couple of discrete examples where they could potentially be life-saving, but this would be, for either one dose or very, very short-term use. And I'm talking about two situations. One is where someone's having a seizure where it won't stop.
Mhm.
Many times, the use of a benzodiazepine can arrest a seizure. People might be familiar with Diastat, which is a thing that parents of children with epilepsy might keep at home, and it's a Valium suppository essentially that they can use if a seizure won't stop quickly. The other situation is drug withdrawal, but specifically withdrawal from either benzodiazepines themselves, which
Right.
obviously if they weren't available, that wouldn't happen, but also from alcohol. Now, you can actually use alcohol to taper down and prevent alcohol withdrawal, but this is no longer considered acceptable in a medical setting. So there were times when, lives have been saved under my care or care of my colleagues because alcohol withdrawal can definitely be life-threatening, and I've seen that several times in the jail setting.
Mhm.
And in the hospital setting. And I even testified as an expert witness in one case of this. It was actually a benzo withdrawal case where a guy got arrested, and it was really for a very low charge,
Mhm.
but they simply refused to prescribe him Xanax in jail, but even though he had been taking it for 20 years.
Wow. So basically cutting him cold turkey.
Yes.
Yeah.
And
I've seen that. Can I pause you there real quick?
yes, please.
Just to give people into like personal insight into what that looks like. My mom cut cold turkey off of a benzo. I don't remember exactly which one. I think it actually was Xanax. I'm not 100% sure. And I witnessed over the course of nearly a year where the majority of the time she was hallucinating, walking through our house late at night, claiming to see apparitions, not sleeping for weeks at a time, sitting in her bathroom, obsessively picking her face with her eyes really wide and pupils very dilated, just staring at herself almost as if she was possessed. Hallucinating to the degree that she thought I was her dad and she was her 13-year-old self again, shaking, akathisia, not eating for weeks on end, not sleeping for multiple nights in a row. It was incredibly dark to witness. And I'm sure you have countless stories seeing this yourself as well.
Yeah, well, I mean, I was, talking about it more in the acute setting, and I want to just emphasize that it's not just scary or uncomfortable, but it's actually, this is a life-threatening situation.
Mm.
I've seen times when people have had, basically, they become delirious, which means they lose their mental faculties, so it can involve hallucinations, but they become disoriented. They may not know where they are, what's going on. And also they have autonomic instability where their basically heart rate becomes dysregulated, and they can get arrhythmias that can be fatal.
Mm-hmm.
And I've, had patients in the ICU or the cardiac ICU because of withdrawal. Wow. So this is a serious thing. In this case that I was involved in, the guy had a seizure, and the seizure caused him to dislocate and injure his shoulder, and he required shoulder surgery.
Wow.
After that. And, it could have easily, of course, been avoided. But, so in that case, if he hadn't been prescribed Xanax in the first place, of course, that situation wouldn't have occurred. But I still think, there is an occasional role for these drugs, but there may be other ways of dealing with those situations that I just don't know about because I haven't, had the experience yet. I certainly did learn initially from Kelly Brogan's work, and then from working with clients myself as a consultant, that there are things you can do that can really mitigate any withdrawal when you're coming off these drugs.
Mhm.
And I'm talking about things like doing an elimination diet or certain nutritional things, doing cleansing, like coffee enemas, for example. And you can prepare yourself and have a much, much easier time getting off these drugs.
Yeah, that's exactly what my mom did. Followed Kelly's protocols, if you want to call it that, after she had cut cold turkey, had multiple suicide attempts and all these things. In order to begin to heal, you could say it was following all of what Kelly recommended. And that's kind of what sent me down this path in the first place, is that. And then Kylie reversing her so-called autoimmune conditions and things like this. So
Well, let me just add one more thing, because I just want emphasize, the danger of these drugs, because we can look at large studies. For example, there's one out of Pennsylvania, which is, I believe there's another similar study with similar outcomes in England, looking at sleeping medications, looking at really it's any sedating drug used for sleep in a large patient population. And there was a significantly increased mortality in 5 years from taking as little as, I believe, something like 11 doses of sleeping medication in an entire calendar year.
This episode was just way too controversial for YouTube, so we decided to put it on Rumble, Spotify, Apple, and all other audio platforms. So if you'd like to watch this episode, just head to the show notes and you can find the link to watch the full video on Rumble.